Welcome to Dr. J's Prescription for Health. I'm your host, Dr. Malea Jensen. I am a family practice physician. I've been in practice for quite a few years, and I am located in Iowa. Sorry about a gently late start. I was texting with Dr. Christy, who just joined. So thank you for joining, everybody. I appreciate it. We do have a live fundraiser for Rescue, Rehab, and Rehome. That is where I obtained my Norman tallow from Norman, Oklahoma. And so we're trying to raise $100, and we got 52 already. And for those of you who just joined and who have already given to Rescue, Rehab, Rehome, I really appreciate it. This is Tucker. Tucker is my co-host from heaven. He's done a very good job keeping me on track, and so I appreciate him. I have 3 others who don't necessarily keep me on track, but we're working on that. All right, this is your opportunity, you guys, to ask questions, ask medical questions. It's your time. What burning questions do you have that you want to know the answers? I will try to do the best I can by answering them. And we'll start out with something that might not be as familiar a term. We don't necessarily explain it in such words, but I've heard it described as this, and it's called the devil's triad. What would be the devil's triad? Any goers on that? Takers, goers, anything? Good morning, Jaco. Well, let me answer this question before I answer that question. The devil's triad is, number 1, sugar. Number 2, refined grains. And number 3, seed oils. That has been considered a evil or devil's triad. Do you guys have thoughts on those? In other words, we are likened to avoid these at all costs. If we want chronic diseases, we aim for the devil's triad or the evil triad of sugar, refined grains, and seed oils. And our chances of having chronic diseases go up existentially high. It's like a linear increase. Jaco asks, yes, Tiger. Jaco asked, I have twitching in my hip and behind it. I'm not sure. Could that be magnesium deficiency? I'm not sure. I don't know what twitching in your hip and behind it actually is. Yes, Jaco, devil's triad, sugar, seed oils, and refined grains. Ruth asks, is donating blood a good thing for health of a donor? I guess, Ruth, it would mean, or it depends on who you ask. Yes, I have one who is using a squeaker toy right now. I am sorry to impose anything on your dogs, Dr. Christy. I appreciate it. Maybe Tito and Lyra need to plug their ears. Sorry about that. I didn't think it was that loud. Ruth, is donating blood healthy for the donor of the blood? It depends on who you ask. There are some people who would say that donating blood helps the donor to relieve them of a burden, a red blood cell burden. I'm not sure. It does stress the bone marrow that when you dump blood or give blood, especially in high amounts, you are actually stressing the bone marrow. Is that a good thing? I'm not sure. So I go both ways on this, depending on, I have people all the time that tell me they feel much better, like lighter or more energetic when they donate blood. I can't disagree with them. They're feeling it. I don't know what's going on in their bone marrow. I don't know how often they're doing it. That is a tough question, and I don't necessarily have a correct answer. Let me see. Having trouble scrolling through you guys' questions all of a sudden. There we go. Now I'm able to move it. Yes, Arthur, as far as hematocrit and blood donating, yes, it does go down. But again, I would ask you, is it going to be a stress on the bone marrow and lead to more problems? These are just things that we need to look up. Here's another one. This one comes up all the time, and it's something that we could probably talk the whole session with. It would be, what are my thoughts on LDL and should we be treating it? Well, what is the function of LDL? First, let's just define what the function is. It is a carrier. It's like a car. It's a carrier molecule for fat and cholesterol and other particles. When we have LDL, we get things delivered to and fro to places that desperately need them. And if we lower LDL, we are lowering our ability to deliver cargo. LDL heals and repairs. It is part of our immune system. The issue to me is not so much the LDL. It's the environment that the LDL lives in. If the LDL were to get oxidized, that LDL becomes much more dangerous. All right? That is how I look at LDL. If it's oxidized, it can become small and dense. It can be picked up by macrophages, and it can produce foam cells. Foam cells are inflammatory. Small, dense LDLs, I believe, are a part of atherosclerosis, okay? They are a part of the atherosclerotic plaque. If we lower small, dense LDLs, we lower our risk of having plaque formation or increasing plaque formation. Small, dense LDLs. How do you lower small, dense LDLs? Great question. You lower them by low or no carbs. Carbs are what oxidize small, dense LDLs. Sugar causing endothelial damage. I would agree. Sugar, being one of the evil triad components, does irritate the endothelial lining. It disrupts the glycocalyx. It causes endothelial cell damage. The stem cells, the progenitor stem cells, cannot keep up with the endothelial damage, and therefore injury ensues over and over and over again. The Band-Aid for such a thing is platelets and white blood cells and red blood cells come to aggregate and form a clot or a Band-Aid. Other things besides sugar cause endothelial damage. It could be smoking, it could be sickle cell disease, it could be heavy metals, it could be iron. All of these things lead to endothelial damage. It could be fluoride, it could be things that are in our water. Dr. Christie is adding to, I think it's symptomatic treatment for iron overload, chronic donations, stress bone marrow. There you go. Dr. Christie is well-versed in iron overload and is just giving her 2 cents. If they do feel better after a donation, it's likely because they did have iron overload. And the few patients, Dr. Christie, that I would say they do fit that category, because I've actually tested their iron studies, and they do have iron overload. Some of them are not on treatment, and I would say it's 50-50. Okay. Okay, so if LDL is not the cause of coronary artery disease, what is? It's It's many things. We've just talked about them. Things that cause injury to the endothelial cells, whether it be sugar, whether it be malformed red blood cells like sickle cells, whether it be heavy metals, whether it be iron, whether it be smoking, tobacco, toxins that are in our body. They can all cause endothelial damage. Could be diesel fumes. It could be burning of plants. All of these things that we take in can damage the endothelial lining and lead to injury. We have mechanisms of repair. We form blood clots, we heal the area, and then the blood clots are basically resorbed. But if the injury continues on a regular basis, that's where we have a problem. So if you're constantly eating sugar, you're constantly smoking, you're going to have constant injury. The constant injury cannot, the healing mechanisms can't keep up with the healing mechanisms. I mean, or with the amount of damage. So healing can't keep up with the damage. And that's why we have plaque formation, that those clots get calcified and lead to, the hard calcified plaques. I go, which one would be worse? Is it the calcified plaque, which I believe is stable, or is it a clot? And that clot can break off. The core, if the core of the plaque, the calcified plaque, is soft, that can cause problems. That breaks off and we got a moving target. That was a good question. Arthur asks, can smoking marijuana make it worse? I think smoking any plant can make it worse. What is the role of calcium scoring tests? I think if that is something you need to determine whether or not you have calcified plaque, then get it. By all means, spend $100, or if the insurance covers it, get a calcium score. If you need reassurance, or if you need proof that your diet is causing problems, get a calcium score. So what is more important when it comes to determining our risk for coronary artery disease? Good question. I think there are other labs besides getting an LDL that help define whether or not we have risk factors for coronary artery disease. By the way, we are live on YouTube and Instagram. We got some good questions over there on YouTube and some not so good. So the labs that I think are important, I believe that getting LDL is irrelevant. If you want to get a small, dense LDL level, by all means, please get that through an NMR, a nuclear magnetic resonance imaging study. But triglycerides are very important. Your triglyceride level, your HDL level, a high sensitive CRP, an insulin level, a ferritin level. I think getting all iron studies is important. Getting an iron level, getting a TIBC, a transferrin. Those are all important. If I didn't mention a high sensitive CRP, I want to make sure that you guys get that written down. But looking at the triglyceride to HDL ratio, that ratio should be less than 1. If your triglycerides are 70, your HDL should be 70 or above. We want that level, that ratio, at 1 or less. Okay? These are good questions. I appreciate that. Some YouTubers are asking what my job description is. I am a family practice physician. I have been in practice for over 20 years, and I practice in Des Moines, Iowa. Thank you for asking. What is my thoughts on fatty liver? Oof, that's a good question, and that is, we're going to require a rather long answer. I think there are many people who do not know they have fatty liver. Fatty liver is a result of eating poorly, eating the devil's triad, eating sugar, refined grains, and seed oils. Sugar or glucose and fructose are the main contributors to fatty liver disease. Alcohol is another. Fructose is highly corrupt when it comes to fatty liver disease. Fatty liver disease is missed on by a lot of doctors because we're not checking the appropriate labs. The triglycerides, the HDL, the insulin, the CRP, the ferritin, we're not checking correct labs in order to figure out whether or not a person is at risk of having fatty liver. Because there is such a thing, I mean, you've heard me say it that, you know, if you just simply look down and you can't see your toes because your belly is sticking out, then you likely have fatty liver disease. That hard fat, your belly that's protruded and you have a hard fat, that is an indication. There are other things that indicate whether or not we have fatty liver disease, but it is possible to be thin on the outside and fat on the inside. That is a very dangerous marker because these people are missed a lot. And they don't know that they are at risk. Fatty liver disease is inflammatory. Inflammation of the liver leads to fibrosis, and fibrosis leads to cirrhosis or even cancer of the liver. Now, if you have fatty liver disease, you likely have fatty pancreas disease, you have other fatty organ disease, you have fatty heart disease, fatty mediastinal disease. Fatty liver disease is a danger. When fat encompasses your heart, your pancreas, your liver, it's choking it out. Over time, you're not going to be able to survive that. It's very risky to continue with a condition called fatty liver disease. I believe that when radiologists should be commenting more on fatty liver disease to bring it to the attention of patients and doctors, and I don't think they're doing that. Why? Because some radiologists have said that 95% of the population has it, and so are we going to comment on everybody? My answer is yes. The doctor should know, the patient should know, and then that gives a segue into the doctor helping the patient how to reverse it. Because is it reversible? Absolutely. How? Lowering your carbohydrates or no carbohydrates. Strength training, sprinting, doing high intensity interval training. Age dependent, of course. Your 80-year-old grandmother is not going to be doing sprinting, or maybe they will be. But if they likely have fatty liver disease, they're not the ones that are going to be sprinting. So would I recommend that for everybody? No. But could they lift weights? Absolutely. Can they do a no-carb diet? Yes. We are giving a lot of excuses for our fatty liver disease and not treating it. What is the earliest age that you have seen kids get fatty liver disease? I have not diagnosed any fatty liver disease in my patients because I don't have a high population of kids in my patient panel. My patient panel are 18 and above. I do not have very many young kids, but I've heard the youngest being 3 years old. That is not good, you guys. 3 years old and fatty liver, what is that kid eating? Likely a whole lot of formula to get their life started, and then their parents are feeding them the evil triad of sugar and refined grains and seed oils. That means a whole lot of processed foods. Okay. You guys have good questions today. I like it. Again, I think the radiologists don't mention it because it would take too much time. I'm not broadly sweeping or painting a brushstroke that all radiologists are not commenting on them. I'm just saying most are not commenting on them because it just takes up more time. And do the doctors want to know? Because now it's going to be in a report and it's going to require the doctor talking to the patient about it. And that's going to take time and another appointment. maybe the doctor is not qualified to talk to them about that. Those patients usually get punted to GI. They'll get a fibro scan, determine how much fibrosis is actually going on, and then they'll likely get put on a medication without being told that their diet and their exercise could reverse their disease. Is the Devil's Triad related to Birch's Triad? I'm not sure. Help me out, Ruth. I don't know what you're referring to. Help me out. Give me a definition, because I don't know. Good morning, Jen. Where are we at over here? These, the comments are going really slow. Gorilla asks, how to reverse fatty liver? One, getting rid of the glucose, the seed oils, the fructose, the alcohol. So the instigators. Number two, starting a regular exercise program. I believe with resistance training and high intensity interval training. If you want to listen to a physician who speaks mainly about fatty liver, Google or go to YouTube or Instagram and look up Sean O'Mara, SEANO''MARA, Sean O'Mara. He talks about it. There's another lady, Rosa, I can't remember her name, but she's actually a radiologist who speaks about fatty liver and why it is so prevalent, why radiologists are not commenting on it, and why I think your PCP needs to know, and why I think you need to know. I think the more information you have, the greater that you can make good decisions. That's why I'm here doing this, is to give you information to help you improve your life. You might not want to, but you're here, you're listening, and you want the information. You just don't want to do anything with the information, like do low carb diet or no carb diet, like doing strength training, like doing sprint training or other high intensity interval training. And that's fine. I suppose that you could say it's your body and you hear me and you still want to eat your lustful food. And I guess that's your right. You are not only affecting yourself, but you are affecting everybody around you. If you guys have a question on YouTube, yeah, Gorilla, 3 years old. I did read about that 3-year-old. Cody says, I always found it hilarious that chronic disease started right around the same time that people started using seed oils and stopped eating animal fat. And we seem to be at a complete as to why. Yeah, I mean, seed oils were probably started in the 1930s. In fact, wasn't it around 1912 that they started using seed oils or developing them? Good morning, Lucy. Good to have you here. Yes, Ola, just fit. Lost cheek fat as a jawline. Yes, in case you guys didn't know, in my younger years, I did a lot of bodybuilding shows, and the amount of dieting that I had and did was, I have no regrets. I loved working out. I loved competing. It was something I could do after my college sports. I did bodybuilding. I made some friends, and yeah, the harshness of dieting to get on stage at 3 or 4% body fat does leave your face and neck and everywhere else void of your fat pads. And I probably started losing my fat pads. They just never came back after my last shows, which was around 2007 was one of my, I think my last show. And over that, during those times of dieting, not dieting, dieting, not dieting, I completely did not regain. Once you lose them, who speaks to this? There's a not a dermatologist. He might be he's into cosmetic therapy. Dr. Rajani, Rajani. He speaks to fat pad loss all the time. So does Dr. Amir. He's in La Jolla. He's in La Jolla in California. He speaks to fat pad loss all the time. And this guy actually does fat pad transplants. I'm not going to do surgery. I know what caused my loss of fat pads. It was over and harsh dieting for bodybuilding shows. It is what it is, and I can't take it back. But thank you, Ola, for commenting. I appreciate that. Ola says, high resistance training ages the face. High resistance or prolonged resistance? You're saying resistance training ages the face. I mean, it's possible, right? I think prolonged cardio ages our face as well. It is, but see, you have to find, what is good for you. If the person knows all of the consequences of exercising, that you're going to lose fat pads in your face, you're going to increase mTOR, you're going to increase insulin resistance. If you're going to do all these things, at least you have the information provided and you can make decisions for yourself. I did not know all of I did not have the information back then that I do now. And I'm not even sure if I had the information that I would have believed it or acted upon it. If they would have told me that, hey, your fat pads are going to be gone by the time you're out of your competition years. And on all honesty, I saw it happening to the people that were competing around me, mostly in men, less so in women, because women, it seems, well, I guess the men too, after competing for a show, usually the wheels were off the bus and they gained all their weight back. But again, it does take a toll. And the men that I see now who are, competing in the years that I was competing, their face looks very drawn, very sucked in. And yeah, their fat pads are basically all gone. And it is, it is what it is. Again, I could go to these physicians and do fat pad transplants from somewhere else, like my belly, and take that fat and put it into my face. I choose not to, but some of you can, and that is your prerogative. Dr. Christie says it's the artificial lights in the gym as well. What? Add to that? I'm not sure. Jaco, we have fat pads in our temple areas. So see the hollow? So temporal fat pads, you have in front of your earlobe or in front of the tragus on your ears, you have fat pads. We have fat pads in our cheeks, and we have fat pads along our jaw lines. So we have these areas where fat pad naturally is when we're born, and then over time, dieting and exposing ourselves to harsh conditions, that leads to the demise of fat pads. You cannot regrow them. They are gone. As we age in general, our fat cells diminish for most of us, okay? They are diminishing as we're aging. And so that's why somebody would tell me that their diet hasn't changed, their exercise routine, their muscle mass hasn't changed, but yet they're getting fatter, like fatter on their gut, fatter on their butt, because the amount of fat cells that they have diminished. So the ones that are left behind or are still present, they're getting fatter because it's not dispersed over your whole body to take up some of the slack. So the parts, like on a woman, her thighs and her butt and her belly or breasts, those are going to grow more fat because she doesn't have fat any other places. Dr. Christie is saying artificial lights, fluorescent lights leading to infertility, lower testosterone, possibly chronic disease. So was there a question that I missed, Dr. Christie, in regards to infertility or lowered? I mean, these are all concepts that we could talk about, like infertility. What is causing our infertility? Is it simply all PCOS? That is one condition. Is it insulin resistance? In your case, Dr. Christie, would it all be iron overload, or would that be a contributing factor? Yes. Is artificial lights, LED, fluorescent lights adding to it? I think it interrupts with our circadian rhythm. Our circadian rhythm is preventing us from adequate sleep. If we don't sleep, we have increased obesity, increased insulin resistance. It's a combination of things. I think there's a lot of things out there right now regarding infertility that we have not looked into. I think we will get eye-opening information if we expand our rabbit holes a bit, so to speak. But you got to ask yourself, why is infertility so common right now? What all of a sudden, over the past years, recent years, is making infertility so common? What causes low testosterone? Could be a number of things. Yes, artificial lights. Yes, high sugar, high insulin resistance is causing low testosterone. These men are aromatizing on their body, in their belly. Their fat is acting like a little ovary, and they're aromatizing their testosterone to estrogen. They're high, very high in estrogen. They're low in testosterone. That is insulin resistance. Insulin resistance is fatty liver disease. Insulin resistance is diabetes. Insulin resistance is Alzheimer's. Insulin resistance is everything, okay? What causes insulin resistance? Is it always just sugar? No, it's not. Could it be anything that disrupts the ability to take up sugar? Yes. Could it deal with the receptor itself? What is destroying the receptor on the cells? What is destroying the GLUT4 receptor on the cells? Could it be polyunsaturated fatty acids, PUFAs? Yes. Seed oils, which are PUFAs? Yes. Iron overload? Yes. Insulin resistance? Yes. So sugar? Yes. All of that. Everything that we've talked about, the evil triad, the fatty liver disease, the LDL getting oxidized, all of these things. Could PUFAs oxidize an LDL molecule, just not sugar? Absolutely. Remember, a LDL is a lipoprotein, lipofatty protein. Proteins can get glycated by sugar. And if the cell membrane is being damaged, polyunsaturated fatty acids, iron overload, all of these things play a role. Is it one thing? No, it's multiple things. It's the environment that we are putting ourselves in. That's what's leading up to all of this. I would like to say it is really simple, and there was one cause, but that's being a reductionist. And I'm not a reductionist. That's how LDL got its name, as the cause of coronary artery disease, is we reduced everything to the fact that LDL is the cause of coronary artery disease. And if we lower LDL, we won't have a heart attack. But yet, heart attacks have gone up. And we're going to blame, and we're going to have many, many, many scapegoats. Okay, and one of those scapegoats could be the blue light. I mean, they're telling you that, that cereal is better for you than eggs fried in butter or ground beef. That things way down here that are causing diabetes. It's not Frosted Flakes and Frosted Wheaties or whatever they're called. It's not those things. It's not Lucky Charms. It's ground beef. For some reason, it's ground beef, and it's eggs and it's butter. That's the cause of all of our problems. It's really weird. When all of those things have actually gone down because they've told us that they're not good for us. Yet, diabetes is going up, Alzheimer's is going up, dementia is going up, fatty liver is going up, cancer is going up. Just Odd, right? Oof, I just messed it up. If you guys asked a question and I have not gotten to it, please just redo it, resend it, because I just lost all of the questions, it appears. Oh my gosh. Oh my gosh. I'm so sorry. Dr. Chrissy, I don't think that we could ever keep people out of the gym, and I don't think the gyms are going to switch to amber lighting. There's going to be a lot of people tripping and falling over themselves at the gym, changing the light bulbs out. From a safety standpoint, what I would recommend is if you're going to be in those lights, and usually that's only for an hour, right? Maybe max of 2 hours. I don't think anybody should be in the gym for 2 hours, but then spend more time outside in natural light. And if you do, something you could change in your own home would be to switch your lights to amber or to red lights. The red lights would be better for you at night in order to, when you're retiring and going to bed. What if ApoB is in the 120s? Is that bad? But otherwise things are normal. I don't know what your version of normal is, and I don't know why you would be concerned about your ApoB. And so those are questions I would ask back to you, because I just want to see what you know. What is ApoB? We have these buzzwords and we're really unable to define them. Like, can your doctor define what ApoB is? Did you look it up? Because ApoB is a type of protein that is on a lipoprotein. All LDLs or all particles, lipoproteins, have an ApoB. So when you measure ApoB, you're measuring LDLs, you could be measuring triglycerides. They all have an ApoB. It's a protein. Your 120 of ApoB isn't going to be indicative of your LDL number. They could go together, but how is it that you could have a very, very high LDL count and an ApoB of 100? Like, how do they explain that? I find it really hard to explain. Plus, when we're measuring LDL, are we measuring particle number, like the actual number of LDLs, or are we measuring LDL cholesterol? And I think that we should be informed, what is your lab measuring? Because you can't just generally measure cholesterol, because cholesterol doesn't float in our blood. It's not water soluble. It's fat soluble. So you can't just measure cholesterol, but you can measure carried cholesterol inside an LDL or inside an HDL. Those are measuring HDL cholesterol, LDL cholesterol. But if you get a particle number, like an NMR study, nuclear magnetic resonance imaging study, you can measure the number of LDL particles or the number of HDL particles. And I think that is more important than these buzzwords getting an ApoB. I mean, a 120, why? I would want to know, what is your triglyceride level? What is your HDL level? What is your lifestyle like? What's your insulin level? What is your CRP? Why are you simply just giving your ApoB? Because I can't make I can't give an educated answer to something that's really not, the question's not adequate for me to give you an answer. Jen says, I'll chime in by placing the blame on excess carbs. Oh, there's a compliment for me. Gosh, where's my helpers when I need them? Gosh, thank you. That was awesome. Any thoughts on BPC 157 and TB 500? No, I don't have any thoughts on those. I don't. Arthur says, I don't trust the FDA. In what regards? Arthur, I don't know the answers to your questions on BP, on peptides. I don't know enough about peptides to make I can't comment. So I apologize. Luco says, is LDL ApoB 120 okay? Otherwise, things look normal. I read your question. Hopefully, I answered it for you. Luco, ApoB is the small cholesterol. Okay, now you're mixing up. Now you're mixing up ApoB with pattern B. So, as a clarification, there's pattern A and there's pattern B. Pattern A would be considered large, fluffy, buoyant LDLs. And pattern B would be signified by small, dense LDLs. That's pattern B. So if your advanced lipid profile showed a pattern B, you would likely have a lot of small, dense LDLs. Your triglycerides would be high and your HDL would be low. So ApoB is just a protein that's being measured in your blood. It has now been shown to be a risk factor for coronary artery disease because now they can't blame LDL, they can start blaming ApoB. Got it? Okay, you're gonna go get your numbers. Okay, good. That would be great. Yes, Dr. Christie mentions the fact that GLP-1 is also a synthetic peptide. So you probably have heard all about, GLPs. GLPs are a synthetic hormone or synthetic peptide that is made by companies in the form of semaglutide, which is Wegovy or Ozempic. We got Mounjaro, which is a GLP-GIP. There's also Zepbound, which is the same molecule. So Ozempic and Wegovy are the same molecule. And Zepbound and Mounjaro are the same molecule. They're just, they have different names because they have different indications. One is for diabetes, the other's for obesity. One is for diabetes, the other's for obesity. They're also a peptide, a GLP peptide is normally found in our body. It's produced in our gut. There's some other cells, like our muscle cells actually have GLP receptors as well. But this GLP has been shown to go down, one, as we age, but two, as we become diabetic, or three, when we're obese. So obese individuals are shown to have less GLP working for them. GLP actually works in a lot of different angles, okay? It can work in our brain to let us know that we're not hungry. So it changes our hunger cycle. It talks to the gut receptor. It makes you feel full faster. So it's going to slow gastric emptying, GLP. Normally, if we're eating, we should get a signal saying, hey, you're full. Unless, of course, we're obese. GLP is going to go down. You're going to become leptin resistant. So leptin's actually going to go up. I know it sounds crazy, but that full line, which leptin usually tells you you're full, gets higher and higher and higher. So people usually end up overeating over time on hyper palatable foods, which are fake foods, processed foods, products, factory products. Those are what we're usually addicted to. I have yet to find a person who said, I'm so addicted to steak, I can't stop eating it. I can't get full on eating steak. I've never heard anybody say that. I've never heard anybody tell me that they overeat eggs. In fact, I've had people tell me the opposite. Oh, Dr. Jensen, you tell me to eat 5 eggs, I can barely eat 2. Okay, what else did you eat? Oh, I had 2 pieces of toast and a bowl of fruit. And then I started out by having a bowl of cereal while I was waiting for my eggs to be made. We're a lost breed, you guys. So, yeah, GLPs. taking a synthetic form in super high, super physiologic doses. That means higher than what our body makes normally. We're giving that to each other. Doctors are giving that to our patients in super physiologic doses, not even knowing what's going on. I mean, can you believe that? What is your doctor relying on for information? The drug companies, the FDA. So you're going to trust your doctor that he or she knows what's going on when they write you a script for a GLP. Do they know that there's cancer-causing agents in GLPs? Do they know that it's causing blindness? Do they know that it's increasing the amount of fat cells that you have in your body? Do they know that you can get peristalsis of your bowel and send you to the hospital right fast? Are they telling you all of these things? Because I believe if they were actually educated on the cons to high super physiologic doses of GLP, there would be a lot less prescriptions. Just my hunch. I can't speculate it because, of course, the prescription or the amount of compounded GLPs that are available, and I think that we're going to see a lot of ramifications from this. It's really sad. Things that have lowered our GLP in addition over time. So things that were on board prior to a GLP even making the news. Because the first ones, I believe, was Byetta. And maybe before that it was Amgen or something, not Amgen. I can't remember. It was when I first got started. There was a GLP-ish medication. And then it exploded around 2011, I think, the GLPs, like Victoza. And then Byetta got reformulated into Bydureon. So there's a lot of history. But again, I don't believe that there has been studies at such high doses. You guys all taking these medicines are the guinea pigs. You're the test subjects. So until there's enough blindness, until there's enough thyroid cancers, until there's enough bowel paralysis requiring bowel resections and stomach whatevers, it's gonna be touch and go for a while. And you guys are the actual guinea pigs. Jaco says, I have a friend who thinks that high HDL and low LDL cancel each other out. You mean high HDL and high LDL cancel each other out? So if your LDL, oh no, you actually mean high HDL and low LDL cancel each other out. Well, they're two different particles. They're two different sizes. And they're two different mechanisms of what they do in the body. So we used to be told that if your HDL was high, it would cancel out your LDL. So as long as you had high HDL, but see, they couldn't make money on that because there's no medicines that raise HDL. There's no medicines that raise HDL. So they kind of went, when I first got started, say 25 years ago, they would say, as long as your HDL is high, it'll cancel out your LDL or the risk factors of your LDL. And so we lived and died on that one until they found out that all the doctors were speaking truth and saying, oh my gosh, if your HDL is high, keep exercising, keep doing your thing, you're doing well. Well, again, they couldn't make money on that. There's nowhere to go with that. So they stopped that. They stopped telling the doctors that high HDL is good and it won't matter what your LDL is as long as your HDL is above 50. And that's when statins came on board. Because statins, you could make money on them. So HDL being high was no longer a protective mechanism. It was all about LDL. And what do statins do to your GLP? by the way. Quiz question. What do statins do to your normal production of GLP? Lowers it. What do statins do to your glucose sensitivity? Lowers it. So it's board trying to lower LDL, which is really, in my beliefs, not the cause of coronary artery disease, and you just caused diabetes, and you just led to more obesity. And then you don't have CoQ10, and then you don't have vitamin K, and then we got blood clots, and then on and on and on, you guys. I don't believe that your doctors know all these things. I could be wrong. Maybe I'm painting another big, broad stroke. I don't know, but from the likes of it and hearing what you guys are telling me, it sounds like your doctors are pretty uneducated. They don't know these things. They're just regurgitating what they've been told, whether it be in medical school, residency, when they got out, by the drug reps, by the FDA or the three-letter agencies, by the United States Preventative Task Force, whoever the agency is that keeps spewing the continuing medical education for the doctor is going to keep feeding the propaganda. That is what if I were to try to get my ideas across to you guys, I'm going to cause you to be isolated. I don't want you to be in contact with any other ideas. I want to actually divide you. I'm going to isolate the doctors. I'm going to incentivize them by seeing a ton of patients. I'm going to encourage them to treat the numbers of LDL. I'm going to do these things. I'm going to only provide CME, continuing medical education, in the medical education that I want them to learn. So I'm going to almost prevent doctors from having the time nor the intelligence to look outside what they've been told. That's called isolation. So I've isolated the doctors. I've propagandized them from the very beginning in medical school, through social media now, not then, through pharma reps. We've all been isolated. So there's no contact with any other ideas. I'm also going to give them an echo chamber. I'm only going to present them, i.e. continuing medical education, with just certain ideas and certain opinions. Only the ones that I want you to know, doctors. So I'm going to give you an echo chamber so all of your ideas sound like everybody else's who are in your little, now we move to the next one. I'm going to put you in a tribe. I'm going to get all the doctors thinking alike, and they're all going to form a little tribe. And humans love to be in a tribe. They love to be in a group. They don't want to be isolated. So I've isolated you, okay, in your tribe, and I've provided an echo chamber of just certain ideas. And I'm not going to allow you to contact, I'm going to make it, it's going to be your idea because you're divided now. And it's going to be your idea. I didn't even have to give you that idea, but you're going to divide yourself. There's going to be the LDLers who think that LDLs cause the cholesterol problem and cause the coronary artery disease. And then you're going to have the not LDL people. And now you got them divided. And so do you think that the LDLers side is going to go over to the non-LDLer side and think outside the box? Absolutely not. But usually the non-LDLers have already been in the LDLers, right? They were in that reductionist theory. And now they've said, okay, you know what? I had some opportunity to go listen to somebody else speak. I just happened to be in the right place at the right time. Or I took a month off from work and I went traveling and I started listening to blah, 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 whatever it took, got them out of their shell. Or like me, a patient kept more than one patient. I want to give credit where credit is due. There was multiple patients who kept supplying me with outside information. And because of who I am, I wanted to let them know that I'm going to read what they presented me with and then report back. So we made an appointment, reported back. So not only am I going to isolate these doctors, I'm going to put them in an echo chamber where they only hear their own ideas. I'm going to put them in a little tribe. All the doctors are going to hang together and all their beliefs are going to be the same because their echo chamber is telling them so, and they're isolated. So they're being hidden from all of the other ideas. What else am I going to do? I'm going to silence the ones that need to be silenced. So the ones outside the echo chamber, the ones that could possibly infect my tribe, I got to get them out of here. I got to silence them, right? So their words might be working, so I can't let them keep speaking, because one doctor could share it with another doctor and get them to jump ship with the tribe and the echo chamber and the isolation. So how am I going to do all of this? Well, I got media, I got reps, I got CME, I got, what else could influence doctors? The TV, that's media. When, you guys, in all reality, I think some of you sometimes get that doctors are all poisonous, but in all reality, they all have the same thought process. Like, they want all of you, the safety. If we were to see what did all the doctors have in common, we don't want to do any harm. We don't want to do harm, and we want safety for all of our patients. We want them to live a happy life and to have jobs that don't steal their souls, and that's what all doctors want. So their ideas are more that they have in common are actually more than they don't have in common. But yet they've been isolated, put in echo chambers, and they're part of a tribe, being pushed into a tribe of believers, so to speak. We are preventing doctors to actually come together and have a whole bunch of ideas that they actually have more in common than they don't. And that's how the division is. That's why they would divide us. And it happens with doctors. It happens in all areas of your life, at work, wherever. They'll eventually get rid of the non-echo chamber people who aren't part of the tribe, who might be giving information that could spoil everything. And so we're going to silence them. Crazy. And, these groups, whoever's doing this, I'm not labeling, I hate the word to say they, but how they do this is, it's really less, how do I say this? These doctors who are isolated in echo chambers and tribes, some are the ones that, they're like a minority in all reality. Like, I would venture to guess that there are more doctors who have more in common, but we're only seeing the fringe, what's on the fringe. We're seeing these people way over here saying LDL is the cause of everything. And then we have these people over here and saying LDL is not the cause of everything. There's other things. And so these are the fringes where we got these held beliefs that fall way outside of the big giant group that's in the middle, but yet they've done a very good job of isolating us, putting us in echo chambers, silencing us, and getting us into our tribes to cause division. It happens everywhere, including doctors. But so, no, I don't think that doctors have it out for you to die. I just can't believe that. I can't believe that, because this majority only wants what's best for you. These on the outsides, the fringes, I don't know what they want, but it isn't for your better, you're on your behalf. So that is why it's important for you guys who do have other ideas, is to share those ideas with your doctors. Get them. That's how it happened with me. Get Dr. J to get outside of her box. Get her to use her brain. Get her to stop just listening at the propaganda, at the one-sided isolation. Get her outside of her echo chamber. Is it possible that she has something that, just more education? Lucas says, ApoB's 120, B to A is 0.8, total cholesterol is meaningless, 261, HDL 71, LDL is 175, triglycerides 74. I would say that you are metabolically very healthy. I would want to know your CRP, high sensitive CRP. I want to know your insulin level. I want to know your ferritin. I would like to know your liver function, and that was one I failed to mention earlier. I want to know your ALT, your AST, and your GGT. I want to know your liver function. I want to know how fatty liver you are, okay? Arthur says 5 eggs and plenty of bacon for me. That sounds yummy. My doctor told me to reduce eating high protein and eat more fiber and veg. I lean for keto diet and do weightlifting. Okay, is it working for you? Arthur says, I'll never take statins. Ruth says polypharmacia. Dr. Christie asks, what about AFib and statins? Do you think they would offer any protection? Well, let's define what the benefits of a statin are first, okay? The benefits of a statin are twofold. One, as an anti-inflammatory, and two, as an anticoagulant. Now, the dose matters on both of those things. And I don't have, I don't know the specifics of how much do you need of a statin to be an anti-inflammatory? How much statin do you need or not need in order to help with coagulation problems? So if they're admitting already that blood clots are a cause of coronary artery or of an MI, of a myocardial infarction, of a heart attack, okay? So if we put the definition of how statins are beneficial, anti-inflammatory, and perhaps blocking blood clots, does that have anything to do with, you said, what about AFib? Like the cause of AFib or the prevention of AFib? Because if you have AFib, that means that your atrium are fibrillated. They're not in sync. There's an electrical problem going on. And so in AFib, there's a risk of blood clots. Being on a statin, is that enough to prevent a blood clot in AFib? Most doctors would say no, and they'll put you on an anticoagulant, whether that be aspirin or Coumadin or warfarin or Eliquis or whatever Xarelto, whatever they're using these days to treat your AFib. So basically blocking blood clot formation. If you're asking, do statins cause AFib? I've never seen that evidence, because remember, AFib is an electrical problem. It is not a coronary disease problem. There's two problems with our heart. One is electrical and one is the plumbing. Now, if the plumbing is messed up, can that throw off the muscular contractility of our heart? And could that lead to electrical disturbances? Absolutely. Did the statin help that? No, because giving you a statin didn't change your coronary artery plaquing. It's not causing regression. In fact, statins increase it. So could statins increase our risk of AFib? Yes. According to everything logically I just And do I have all these studies to, no, I'm just thinking logically, like I'm thinking about mechanism of action and I'm thinking how things happen. I don't need a study for that. I just look at my patients. Do you know what the best study is? The eyeball study. The eyeball study is the best study. Look at your patients. Look at their diseases. Look at their numbers. Look at their body habitus. All of these, look, just use the eyeball test. Most doctors are educated enough that they could look at you and say, you don't look so healthy. Why? See, what we're doing as a doctor, we've been trained to make a diagnosis. We got a diagnosis. You have an irregular heartbeat. I heard it right now. Let's get an EKG. Oh, you're an AFib. Perfect. Here's your medicine. What caused it? Well, I had some heart failure for a lot of years. Okay. What else? Can't take back the heart failure now. We're just making diagnosis. We're giving you a diagnosis. We're putting you into the insurance algorithm. And then we just give you a medicine and then we pat ourselves on the back. I mean, it's a beautiful thing. And then if we choose the wrong thing, then it allows you to sue us. So we choose the wrong medicine, or we gave you the wrong dose, or we didn't look into the side effects, and that's why we have the Dr. Christie's of the world, who are the pharmacists at the pharmacy, doing the thing and saying, I think that doctor made a mistake and I'm not going to fill this prescription. I mean, they can really do that. I mean, most pharmacies will call the doctor and say, hey, did you really mean this? Because I was just running my normal algorithm on my computer and it said, hey, this doesn't go with this one. Do you think that you might want to tell the patient, or do you want me to? So we have checks and balances, or at least we did. But in today's society, the pharmacist can go, no, I'm not going to fill that because it's against my better judgment. Doctor, I don't know which way is right or wrong. I really don't at this time, because they're giving so much power to doctors and pharmacists, for that matter, as if they're these most highly educated and everything they say is absolute. There are people on the streets who know more than doctors and pharmacists. They are. They're listening to me right now. They know more than the doctors I know in person. You guys, you're highly educated. Never went to medical school, never went to residency, never went to pharmacy school, never took boards. You just learned. You listened. You went reading. You actually used your brain. You think logically. You go back and forth. You have questions. You have an inquisitive mind. You have questions. Imagine that. You can't just be told, because that would put you in a position to be isolated without contact with the other side of the story. It puts you in an echo chamber. It puts you in a tribe, and it silences everybody else. Not you guys, not my listeners. Oh no, you guys are highly educated. You're using your brain. I love it. That's why some of you bring stuff to me and say, Dr. Jensen, let's really discuss this. M2 Royal had to come over from YouTube because there's too many goofballs. I can't ask questions. I know, and I apologize for that, but eventually they will wean themselves out, okay? M2 Royal. They will wean themselves off and out because they're not getting any attention. And that is the definition of beating a narcissist, because that's what they are. They're evildoers over there, okay? And so we'll win. In the end, we'll win. And thanks for joining me over here. Ruth from Iowa says, peer-reviewed by peers who agree. Right, that's called an echo chamber, Ruth. Somebody said, I want a peer-reviewed, double-blinded, randomized clinical trial that's blah, blah, blah. Peer-reviewed. Oh, geez, are you kidding me? They're the ones that are isolated in echo chamber tribes, and you silenced everybody else. That's what you guys are reading. So only the people that are reading the studies and then they blame the Ruths of the world and say, show me a study, Ruth. Show me your study that proves you. Why? Look, I use the eyeball test. I don't need a peer-reviewed, echo-chambered, tribal isolated group to tell me what's the truth or not the truth. No, I use the eyeball test. I can look just at my family member or my friend and say, yeah, you're not healthy. I don't need a peer-reviewed study to tell me that. I just look at your skin. I look at your eyeballs. I look at your belly. I look at the way you walk. I look at your lack of exercise and I look at your lack of brain function. It's all very obvious to me. I see you sleeping. I see you sleeping at your desk. I see you grabbing a Coca-Cola to wake yourself up. I see you depressed. It's called the eyeball test. It works. M2 Royal says, what do you consider high dose GLPs? I'm on 5 milligrams once per week. As far as I understand, all these meds do is kill the hunger drive. I've been thinking about hopping off of them. As far as I, M2 Royal, understands it, all these meds do is kill hunger drive. Then I would suggest that you look into everything else that a GLP does. Did you look into the aspect of blindness? Did you look into the aspect of cancer? Did you look up into the aspect of bowel paralysis? Did you look up the probability or possibility of fat cell hyperplasia? Did you look at all these things? And honestly, is the dose 5 milligrams? I mean, who told you that that was safe? Was it the drug rep companies? The doctors who are in the isolated echo chambers of a tribal group? Who's making money off of who? Why are you on it? Why would you have taken the first 5 milligram dose once a week? Why? Well, I'm overweight and obese, Dr. Jensen. Why? Did you, before shooting yourself with some unknown medication that they told you was okay, that you didn't look into, and as far as you know, the only thing it does is kills the hunger drive, you didn't look any further, right? What caused your problem in the first place? Why are you overweight and obese or obese? Why do you have insulin resistance? Why do your joints hurt? Why can't you sleep? Why does your skin look older than it should be? Yet you will choose the 5 milligrams and now you're thinking about hopping off of it. Okay. Tell me more. Dr. Christie's asking the name of your GLP. M2 Royal says it's Zepbound. Been on it for a while. And side effects are minimal because you've gotten used to the side effects. You're used to them. You've always been used to them. You love the fact that you've been nauseated and constipated or diarrhea. You didn't think anything of it because that's the way your life was before, most likely. Minimal side effects, but I don't think that's what is causing me to lose weight. I think it's my more disciplined look at food and exercise. Then why stay on it, M2 Royal? Arthur says, so wonderful that you answer these questions. You're very welcome. M2 Royal says, the doctor told me it would assist my metabolism. Let's define metabolism, because did they use that word? Did they use the word metabolism? Metabolism is a culmination of all the building up and the breaking down biologic and physiologic processes in your body. All of the anabolic and all of the catabolic, they weigh themselves back and forth, and that is called metabolism. Now, assist your metabolism, which anabolic or catabolic? Which metabolism component did your doctor say it would assist in? Because we use this word haphazardly without really defining the word metabolism. Am I making sense to you? Now, if the mechanism of action of a GLP is to limit the amount of calories or food intake, food being that which has nutritional value. So that means they told you only eat nutritional value food. So that would mean no box or bags or processed foods or seed oils or sugar. Did they tell you that? No, likely not, because they didn't have time, because they're seeing too many patients, because they're in an isolated echo chamber tribal group. And so they're all doing it. They're all seeing 40 or 50 patients a day. And they silenced all the others. Okay? So assisting your metabolism. Let's go back. We're going to assist your metabolism by giving you a GLP at minimal doses, right? Minimal. This is the low dose of your Zepbound. It's not 2.5, it's 5. It's not 10 or 15 or 12.5. It's none of those. It's just 5. So it's minimal. Don't worry about it. There's no real side effects. Did they say that? I would probably have written that down, quoted them. I would have said, can you put that in my progress note so I can come back and get my note from you? No, you didn't think about that. You just trusted the doctor telling you that it's going to assist your metabolism. By you not eating as much, what happens to metabolism? In your definition, the speediness of you burning calories is what you think metabolism is. It goes down. If I put less in me, my body's going to clam up. It's going to think there is starvation, like we're on a desert island, or somebody just SHTF or whatever that one, right? And so you got locked up in your house and there's no food. So no calories are coming in. Your body hibernates. What happened? If metabolism is the speediness, it's like 0 now. So you think it destroyed your metabolism doing some dumb water fast. Was it the GLP that destroyed your metabolism? Or do you really think a dumb water fast caused it? What would a water fast do to you? You think that was harmful? Dr. Christie says, my thoughts are that your water fast they only did one, Dr. Christie. According to that, it was only, 5 or 8 days? Right. There was only one fast. It was only once a month. Okay, once a month, only water. So once a month, 1 week out of every month. Okay? So Dr. Christie is saying that contributed to severe, Dr. Christie, what is the definition of severe? Is it severe as in death? We could just say it caused her or him to be malnourished. That means that they lacked food. Now, could 8 days? Now, think about this, Dr. Christie. We don't even know what M2, whatever it looks like, or their body habit is. But to require a GLP, we would assume that they are obese and overweight. They're not malnourished, Dr. Christie. They're carrying a suitcase full of energy. They're more malnourished by what they were eating before because it had no nourishment. So they're malnourished, and the body kept searching for food. Instead of using their own, they kept searching for more nourishment. So the person, because they're hungry, grabbed no nourishment. And then the cycle began. So no, I don't believe that the fasts in an overweight, obese person caused malnourishment. In fact, it actually increased their metabolism after 5 days. 3, 4, 5 days. Now they're burning ketones. Ketones worth 4 calories, just like a carbohydrate. Now they're supplying nourishment to their body. I'm just playing the one that's being silenced right now, Dr. Christie. I'm not trying to put you down. I just want you to think. This is, again, I'm trying to get you to think logically. The person was already malnourished by the choice of their food. By going into ketosis and getting fat adapted once a month actually helped autophagy, up and down of mTOR, decrease their insulin levels, gave them more energy because now they're on ketones. So after that 4 or 5 day mark, they actually got a second wind. And so you, like many doctors, are going to blame that water fast on their lack of metabolism when actually their metabolism started working. My thoughts. We can talk about this another time. Marnie says, my brother insists on studies for everything, yet took the experimental jab. Right, there was no studies, right? I mean, we are the study currently. We are still their pawns and their guinea pigs. And it's, Marnie, at some point you got to let it go with your brother. He made his choices. I'm sure he's an older adult. He's a young adult or an older adult. I don't know. Dr. Christie says, oh, well, Fauci has the studies. That's a possibility. So Marnie, if you want to write Mr. Fauci, maybe he will send you the studies and then you could go over them with your brother. M2 Royal says, see, I knew something was fishy, Christy. My doctor claimed GLP will assist with my weight loss journey. Okay, let's talk about that. Will it assist with your weight loss journey? By definition, if I put no food into M2 Royal, you will lose weight. Okay? It just seems obvious. Now, the food or lack thereof, fake food that you do put into your body could continue to raise insulin levels. I have had many people who have eaten through the GLPs. And the dose, we just keep raising the dose over and higher and higher and higher. They can eat through it. Okay? The weight that you get assisted on losing is usually muscle. Most of it is muscle. You also, just so you know, M2 Royal, your weight loss, when you lose it with a GLP, your skin, the resilience of your skin, you will get a pannus. You're a flap of skin and fat on your belly. It will hang down like an apron. We call it an apron. But if you were to have lost weight by changing your diet, lower insulin foods, which lower insulin provoking foods, as in low carb, no carb, you would have lost weight progressively. And guess what would happen to your skin and your elastin and collagen and all that? It would have improved. And so you would have less excess skin than by taking the GLP. But that's just an aside that you didn't know. And obviously your doctor didn't tell you that either. They didn't tell you to exercise and keep your strength up and keep resistance training because you're going to lose muscle mass. They didn't tell you that part. It would help prevent fatty liver. Your GLP is going to assist with your weight loss and help prevent fatty liver. Prevent it. My guess is you already have it. Now, what causes fatty liver? I already said it. Glucose, fructose, alcohol, excess glucose, right? So did you, when you went on your did you change your dietary pattern? Because if you continue to eat the exact same foods in small, frequent doses, your insulin never has a chance to come down. If insulin doesn't come down, what happens to your fatty liver? Does it stay there or does it get better? It stays there. Your insulin is provoking fatty liver, fatty organ disease. It isn't what you put into it isn't the amount that you're putting in. If you're still provoking insulin, you're going to continue to have fatty liver disease. You probably have fatty, if you're insulin resistant requiring a GLP, you have fatty liver disease. It's by definition. So it's not going to prevent it. It's not even going to heal it because they didn't tell you to stop eating carbs. You can't lower your insulin without lowering your carbs. Carbs, sugar, fruit, fructose, and glucose. They're raising insulin. Insulin causes cells to get bigger, fatter. GLPs didn't do anything with that. M2 Raw says, my doctor never specified between anabolic or catabolic assistance. I think I need to find a new doctor. Well, good luck trying to find one because they're all in an isolated, echo-chambered tribal group. That's why you're listening to online doctors. I'm sure I'm not the only doctor you're listening to online. M2 Royal says, I will say I did feel fantastic after finishing those fasts. Tell me, M2 Royal, how did you end your fast? How did you end it? Did you end it by splurging on a bunch of carbs? See, what happened at 7-8 days is you started digging in and you started becoming more metabolically flexible. It's truly amazing what your body feels like on ketones. You just never experienced it because you continue to either end your fast back with the exact same foods that caused your problem in the first place. Okay? Dr. Christie says 8 days per month for a year seems extreme. It sounds extreme to you, Dr. Christie, because you likely don't have enough energy on your body stored up like M2 Royal. So extreme to you might feel, not so good. Yes, already malnourished prior to fast, then 8 days per month. Not taking in amino acid nutrients, ketones alone provide that. Yes, ketones alone can provide everything she or he needs. There was a study done, I believe it wasn't the Netherlands. Where was it? Scandinavian. It was a Scandinavian country. And this person went 365 days without eating. They were not malnourished, Dr. Christie. They were living on their suitcase of energy. They were not malnourished. They were checked. They were medically supervised. I'm guessing that person took water. I don't know if they did electrolytes. After a certain amount of time, your inner body water will will obtain homeostasis. I was given an example of how people want studies when it fits their narrative. Yep, that's true. That's the echo chamber tribal mentality that's isolated, where they're being, think about how many times you have been put into a system. Just think about your job. Think about your job, you guys. How you were made to be isolated. How they echoed just certain things they wanted you to know. And they didn't want you to contact anybody that could have a different idea than what our company does or what our job description says. I need you to isolate yourself and not listen to them because they're voodoo, they're corrupt, they're like a cult. Don't listen to them. Just listen to me. Listen to me and everything will be okay. They're going to isolate you. Think about how many times you've been isolated and placed in an echo chamber. They're only sending you emails they want you to know. They don't want you to read any books. They don't want you to go listening to anybody else on social media. They don't want to have you do any of that. Okay? Isolation in an echo chamber. And then they're going to make you feel wanted. They're going to put you into the little groups. And they're going to make you feel all warm and fuzzy that you're in a tribal group because that's what humans do. We want to have communion with others who think just like us, Marnie, right? That's what your brother has. He's just in a different tribe as you. For clarity, I was 350 pounds, 6'4", 39% body fat. Now 315, 29% body fat. So I definitely was still and am carrying excess fat. Okay. What else do you guys got? What else do you guys got? I'm trying to read your questions. All right. Well, doesn't look like there's any more questions coming through. We talked a lot today. If you guys would like to schedule a consultation with me, go over your labs, just discuss diet and health, maybe discuss things like M2 Royal brought to our attention. These are just common things that are brought up on a regular basis by doctors who might use words that we're really not familiar with. We really don't go look them up because we didn't think anything, because in our mind, we already knew the definition. Like M2 Royal thinks they know the definition of metabolism. But really, by definition, they didn't know the exact meaning of what metabolism is. And so we have doctors that, or anybody, okay, I'm just picking on the doctors, but we get in our head a certain thing, and we can use big words because we make patients feel dumb. We make them feel below us. Like our answers are the only answers, and we're right. And we're never really challenged, because who wants to challenge their doctor? It doesn't feel very good, because the doctor can really just walk out and say, you're fired. I don't need to see you anymore. If you don't want to listen to what I have to say, then don't come back. They have that ability to do that. And so then you feel bad. You say, no, you've been my doctor for so long. So you then beg to get back into their echo chamber, their tribe, because you don't want to feel left out. What is that? Feelings of being left out? What is that? That is human nature. You guys, we need to toughen up. We need to get our own identity. We need to stop just blatantly listening to people without questioning. Is that true? I don't know. Extreme calorie deficit caused hair loss. Is this due to malnutrition or shock to the body due to low calorie intake, or both? Probably both, Letty. And anytime you change your diet, if you were to go from a standard American diet to a vegan diet, or a standard American diet to a carnivore diet or a lion diet, because of the stress or shock, yes, you could lose your hair. If you get sick, you could lose your hair. Any type of stress to the body, because it's going to, your blood flow and all the nutrients, the hair and your nails are like the last of the things we're going to try to preserve their hair. But body's saying, I'm going to preserve the heart, and I'm going to preserve the liver and the gut and the skin. I'm going to do all these things. And then the hair and nails might be last. So it's not so much, is it a calorie deficit? It could just be a change. You could have the exact same calories, but it's calories of all ho-hos, or is it calories of a steak? And we're accusing one way or another. I mean, you might just be living the dream on 1,000 calories of ho-hos every day. And you change that, and you're going to lose your hair, because it's a shock. Like you said, it's a stress. So you tell yourself, I'm going back to the ho-hos because I didn't lose my hair on the ho-ho diet. See, we're being told we're not really using our head and thinking about something. So yes, it's stress. And like I said, what are the calories? I don't even like using calories, because calories is a measure of heat. Does everybody use a calorie the same way in their body as a measure of heat? No. So you're telling me a steak and a ho-ho, 100 calories of steak and ho-ho are the exact same thing. One will give you malnourishment and one will nourish you. Yes, fear of missing out. Thank you, M2 Royal. That is it. FOMO. FOMO. Fear of missing out. Dr. Christie says we need to stop counting calories and focus quality of food, avoid processed foods. Yep, we need to avoid the evil triad of sugar, processed foods, well, really refined grains, and seed oils. Get rid of those, because processed foods is likely all three of those. Yeah, Letty, so you went from a standard diet to keto. So that changed. I mean, congratulations, but you could have went standard diet to vegan diet and it would have caused the exact same thing. So don't blame the keto, don't blame the vegan, blame or congratulate yourself on actually getting a symptom from changing. That's good for you. Good for you. No matter what diet you went to, it's the one you went off of that made the biggest difference. Rez says, I have reduced my calorie of carbohydrates like bread and rice, but I use a lot of fruits. They are mostly rich in sugar. Well, they're rich in fruit. I don't know where you're speaking from, so what country? I mean, in America, I can only speak for Americans, our fruit is a combination of fructose and glucose, mainly fructose. And fructose does not go through glucose pathways, so we metabolize it differently. It goes directly to the liver. We are at risk of fatty liver disease with fructose. So your rice likely caused less fatty liver, it depends on how much glucose you were taking in, than the fruit. Now, if you told me that you were eating wild, seeded, in-season fruit, like grapes, seeded, in season, so seasonal, seeded, wild, then I would say, okay, you made a good choice. But I'm not, I can only speculate, I'm not gonna assume, but I'm guessing that you did not choose those fruits. And so you likely have worse fatty liver and worse insulin resistance by consuming fruit. Dr. Christie says, could be a detox too. A detox, I don't know. Letty says, thank you, doctor. I did reverse a lot of troubles I was having. I imagine you did. I mean, anytime you went from a standard American diet to any other diet, I mean, I bet you feel amazing. And who doesn't want to feel amazing who's listening right now? Rez asks, should I reduce fruits? You need to do do a trial. No one's telling me what to do, but have you ever just made up your mind and say, hey, I think I'm just going to stop fruit and see what happens? Okay? Lowered A1C, lowered blood pressure, lowered inflammation. So, in essence, Letty, you are telling us that you lowered your insulin, right? If your blood pressure was elevated before, it means your insulin level was high before. If your inflammation was high before, it means that your insulin was high before. So by going on your keto diet, you lowered your carbohydrates, which lowered your blood sugar, which lowered your insulin, which diminished your risk of high blood pressure, inflammation, and your A1C, which is a sign of diabetes. Yes. Good? All right. Okay, you guys. So for consultations, you can email me at IronLadyDoc@AOL.com. Please share this information. If you find that it's helpful for you, whether you're on YouTube or Instagram, on those, and Rumble, on Twitter and Threads, I'm at IronLadyDoc. On Facebook, it's Center Stage Primary Care. So you can message me, you can email me at IronLadyDoc@AOL.com and schedule a consultation. I have several of you who have written me saying that you will send your labs and want to get scheduled and then never really act on it. I'm not going to keep chasing you. I might once re-email you and say, hey, are you still interested in doing a consultation? But otherwise, if it takes me more than one time to remind you to if you want to send the labs to me, let's get it going, I'm not going to keep chasing you. That means you really didn't want to spend the time with me and go over your labs. So the lab they don't mean anything to you. You want to, one, either continue what you're doing, you don't want to hear the truth, or two, I mean, I don't know what the excuse is, but again, I just want you to know, I do get your emails. I do email you back, and if I don't, please keep emailing me or ask whoever it was that referred you or message me on Instagram, because I've never really, except for one time, it went to my spam where I did not answer somebody back. But there are a lot of you I answered back. I sent you forms to fill out, and you never acted upon it. I'm not going to continue reaching out. I'm not going to chase you. I'm not. So if you want it, in your heart of hearts, you want to find out just how bad you are, how good you are, and how you can make changes, set up a consultation. Okay? All right. I wish you guys a blessed Sunday. Go in peace and serve the Lord. See you guys.